I'm a visual learner, and many people are probably familiar with the visual that defines equity versus equality. And so when I think about equity, I think about creating a situation, an environment, a process where everyone has their fair shake, right? Where everyone is able to have the tools, the resources to be successful and to support their well-being. And that's something that isn't currently the case, but we're focused on it now more than we ever have been, which represents a lot of hope in terms of us actually being able to address the root of the issue. I would say my interest in psychiatry was probably primarily driven by my experiences growing up with a mother with schizophrenia. And despite her struggles with schizophrenia, loving mother. She was, the best mother someone could have. She taught me what unconditional love was, and what kindness was, and what resiliency was. And I think that, those are not lessons that you can learn in school, right? And so those are invaluable. We had a lot of difficulty getting her care, and initially that actually turned me off from psychiatry because I was thinking, if the profession, if the system can't help a family like ours, then what's the point? And so when I went to medical school, I was actually on the path to going into emergency medicine. And then I did my psych rotation, and I saw people get better, right, in ways that my family didn't have the opportunity to experience with my mom. And that really kind of turned me towards psychiatry again. So I'm the director of the Substance Abuse Prevention and Control with the Los Angeles County Department of Public Health. Our agency is responsible for managing the specialty substance use prevention and treatment system across the county. And so we have a network of community-based prevention providers, student well-being centers that offer substance use education, harm reduction sites, DUI programs, and then the treatment programs that comprise our drug Medi-Cal network. I think that justice reform is going to be incredibly important for us to make substantive progress in the SUD field, just because for so long, we've kind of engaged in this war on drugs that really hasn't worked. And what it's done is it's essentially worsened the stigma that's been associated with substance use. And so the extent to which we can continue our work to provide services as opposed to jail, I think will allow us to not just help people who are currently incarcerated, but also just change the public perception about substance use as a whole, right? I think one of our greatest challenges is that, according to federal data, 95% of people with a substance use condition either don't think they need help or don't want help, right? And so we need to find a way to address that effectively. And a lot of that involves intrinsic motivation of individuals, clients. And intrinsic motivation, it's not something that's fundamentally easy to change, right? And so it takes significant engagement at different levels, right? So in schools, right, at a very early age, what is behavioral health? What are mental health conditions? What are substance use conditions? They're treatable, right? They're not problems with morale or someone's morals. They're not problems in terms of being a criminal. The more that we can disconnect those concepts from a young age all the way to individuals who are currently impacted, I think the more that we'll be able to shape that perception. When we say things like, come back to us when you're ready for treatment, that turns people away, right? And when we have a condition where 95% of people who need care don't want it, we can't be turning more people away. I've always believed that with fundamental challenges like social injustice, we have to change both hearts and minds, right? And so from a big picture perspective, if we could somehow change the mindsets and perspectives of people, back to when they were toddlers, right? Where it's very clear toddlers do not differentiate between many things, right? Whether someone's homeless, whether they have a substance use condition, they don't pay attention what color they are, right? They don't pay attention to any of those things, right? If you smile at them, they're gonna smile back. And so how do we do that, right? How we do that is through conversations that start from an early age and that end when people are very, very old, right? Essentially, these are ongoing conversations to really shape the way in which people see others and see some of our biggest challenges, right? You know, I would say despite all the challenges we've had, whether it's pandemic or social unrest related, there's a lot that's given us hope. And there's a greater focus on some of society's biggest challenges, whether it's homelessness, equity, criminal justice reform. All of these are projects that we're working on right now. And I think they all represent tremendous opportunity for us to serve our clients better and also ideally to prevent individuals from entering the system to begin with.